Get started. Gary, what's up first?
Yes, today is Tuesday, June 23rd. This is your issue session. We'll do roll call. Chair Bernard.
Here.
Commissioner Fisher.
Here.
Commissioner Savas.
Here.
Commissioner Schrader.
Here.
Commissioner Humberston is not yet. There he is. Commissioner Humberston is here. I'll let him say hello, although he has my name. So, Drenda, can you change his name, please? Ken is here. All right. We have several issues for you today. We'll start with coronavirus update. Nancy Bush, Director of Disaster Management and Incident Commander of our Emergency Operations Center. Go ahead, Nancy.
All right, thank you and good morning. So we have our numbers for today. In the state of Oregon, there's 7,083 positive, which is up 511 from last Friday. There are 192 deaths and 199,545 negatives. Clackamas County has 607 positives, which is up 46 from last Friday. There's 23 deaths, which is up 1, and 19,435 negatives. Multnomah County has 1,849 positives, which is up 135 from last Friday, which is the highest weekend that they've ever had. There are 68 deaths, 42,677 negatives. Washington County has 1,078 positives, which is up 18, 20 deaths, and 26,759 negatives. Hospitalizations are now 93, which has been climbing over the last few weeks. Just a few things that are going on. Clackamas County has reopened our services here in the Development Services Building and the Public Services Building. That started yesterday, and I did do a walkthrough around noon, 1 o'clock, and everything seemed to be going smoothly. Talked to a few people. Yesterday went fairly well. Tomorrow, the governor's mask mandate goes into effect for Clackamas, Multnomah, Washington, Polk, Marion, Hood River, and Lincoln counties. So just to remind everyone of that. Our logistics team and social services in our operations branch is working on agreements so that the rental assistance dollars can go out pretty quickly and get out into the community. Public health is working on 7 long-term care facilities, or with 7 long-term care facilities with active investigations. There are 3 new business outbreaks, 4 new businesses with cases, but they are not in outbreak status at this time. 15 or more of new cases is now our daily normal here in Clackamas County. We are expecting some new COVID investigation guidelines this week from OHA, and we are now working with the new software here in Clackamas County that was provided by OHA, and making sure that everyone's getting trained on that. We also still have new hiring underway, and we're looking for Spanish speakers for contact interviews. Behavioral health has 15 events scheduled this week with our GO team, which I believe is the highest week we've had so far. And lastly, I just want to talk a little bit about the fairgrounds. The fairgrounds, as you guys know, had a couple of requests into us. One was for a cruise-in, which is in August, and one of them is for drive-in. So Mr. Schmidt has looked at those, and we have approved those. I did talk to, because there is food for the drive-in, so I did talk to environmental health, and we worked through that the last couple of days, and then again this morning. That will be open, of course, after 10 o'clock, because that's when it gets dark. But because they're not a restaurant, we looked at the guidelines to make sure that they weren't considered not open after 10, but it's not a restaurant. They're actually using food trucks. So we are comfortable with proving that. And I don't know, Gary, if you want to talk about that any more than that.
Yeah, we don't need your formal approval, commissioners, but you want me to know what we're planning on doing. So if you have concerns, this is an opportunity for you to tell us about that.
All right. We good? Oh, Ken?
Yes, I just want to thank staff for expediting this as you have, and yet still doing it carefully. I appreciate the role that you have with respect to trying to protect people from our worst instincts, I guess you could say. But this means a lot to the Fair Board, and on behalf of the Fair Board and as the board liaison, I want to thank you very much. This is them trying to find a way to make some money under the circumstances, given our loss of tourism revenue and everything else. So thank you so much for the work that you put in and expediting it.
Thank you. You're welcome.
Paul and then Sonia.
Yeah, I wanted to talk about it. Nancy, if you had any insight, I'm kind of going back to the governor's response letter we got back on Friday. I'm actually struggling with what basis of which they are going to go forward with now that we're, apparently the messages were going to be tethered to the other two counties. But I was kind of taken aback by the mention of the care facility in Canby with the outbreak as being cited as a reason. I emailed you all, I emailed Gary and yourself, or Gary contacted you all to confirm what I had the understanding of, and that was care facilities like that are actually licensed by the state, and that the state is the one who has responsibility for any kind of an outbreak at those typically. And it seemed to me that being their responsibility to prevent those things from happening, that it wouldn't be something that they would use as a rationale, perhaps, maybe against is a strong word, but use as a reason to deny our request for the phase 2 deal. I guess our responsibility, as I understand it, is solely if there's deaths. Our responsibility at those state licensed facilities is that our role is to investigate the death, but it's not the prevention aspects. It seemed to me that the state, by implementing its own guidelines or trying to work with the private operator, would make sure that they're the shining examples of maybe preventing COVID. So can you enlighten me as to, number one, that aspect of the state licensed facilities? Because I know there's outbreaks in prisons, state prisons that are state ran. It seems the reason I asked 2 or 3 weeks ago to parse out these outbreaks was primarily to look at, what kind of facilities those are, situations those are, what we do for prevention, and see if they're actually situations that risk the entire county or community. If they're isolated, that's great, and we got contact tracing, that's great, and it's less of an issue, whether it's, unfortunate, no cases should happen, but if it's 30, 60, or 100, and they're isolated, it's less significant than 100 random cases out there in the county, so, which is more concerning. And I appreciate the work that Dr. President did in giving those percentages, which was helpful to some degree, but I was, again, taken aback by that would be the rationale, when I understood the rationale was simply we're trying to keep hospital admissions down, and we knew that increase in cases would happen as a result of phasing in the first place. So I'm at a loss trying to figure out how we improve our numbers. And secondly, or if I haven't added enough layers on this, I apologize for this. The other issue is that how do we, well, I'll stop there. You answer those, and I have one more question.
Okay, so yeah, I think there's several things going on. So the state does work with long-term care facilities, and throughout this, they have provided PPE to them as well as training and other things that they need in for that licensure piece that they do. So the outbreaks, though, in those facilities are the responsibility of public health. And so public health does go into those long-term care facilities, works with them on outbreaks, whether if it's flu, COVID, whatever that may be. We do work closely, obviously, with our long-term care facilities. And the other issue around that is too, because we have, of course, there's staff in those long-term care facilities who do go into our communities, even, and they are positive from, because they are also tested there. And then they go home, they go to the grocery store, they do that as well. So that also ends up being, part of the outbreak from that facility that may go outside of the facility. So that is how, we are, tied together with the state in order to assist what goes on in the long-term care facility, as well as what goes into our community. I hope that answers that.
So clarification. So, when there's an outbreak, public health goes in, right? Is that what you're saying?
Yeah, public health works with that facility for the outbreak, yes.
Okay, so from a state licensing standpoint, the state's role, would it ideally not be a good idea that anyone that is state licensed follows the state guidelines, and that the state's doing the oversight to make sure that they're implementing all of the guidelines that are on the state website?
Yes. And I don't, yes, it is. And that is up to the state and the long-term care facility to determine if that has been done.
Okay, so essentially then, the argument of not, my concern is that should we, should that have been a rationale for the governor to say, or the governor's office to say, oh, we're going to deny it, and look at you, Clackamas County, you had this outbreak when it wasn't ours in the first place.
It is, but it isn't, because we are linked. I mean, obviously the facility is here in our county. A lot of the staff live in our county or in our surrounding counties. So I can't say that it is just the state's problem. It is also our responsibility to work together.
As long as she's
It's a
using
partnership. It's a partnership.
as long as she's using the same measurement statewide, it's fair. But let's move on to Sonia and then Mark.
I'm not, Jim, I wasn't.
Well, Paul, I mean, you're taking up the whole time, and I have other people waiting to ask questions. Can you hold off?
Till when?
I guess after this. I mean, we only have an hour. We can continue this. Well, go ahead, finish up. I mean, you're taking up all the time. I'm just trying to let other people ask questions.
Well,
Go ahead.
so another thing out of the governor's letter is that the suggestion is that we're going to wait another 21 days. And let's just say, I'm just trying to understand if you know anything that I don't know, okay? So if we wait 21 more days and our numbers, let's say I look good and Multnomah County's looks bad and Multnomah County's not ready, are we going to move in 21 days? I mean, what do I tell the businesses? Because everyone's asking, this is important, okay?
Yeah, it is.
With a lack of with all this uncertainty and the lack of clarity, we don't even know what's going to happen in 21 days. So what will happen in 21 days?
So my understanding right now from the governor's orders is that we are waiting for her. She is saying that she will move us forward as a region. So my understanding is at this time is if let's say all of our check marks turn green, that if she wants us to continue to wait for that 21 days, then that's my understanding, that we are going to wait to go together as a region. So if Multnomah County and Washington County aren't ready, and we may be, my understanding is that we will still continue to wait as a region.
Well, yeah, well, that doesn't settle with me very well when I consider that there wasn't all greens in all the other counties that went from phase 1 to phase 2. They had reds and they still went forward. So now we're raising the bar even higher. Not only are we tethered, but now we're going to raise the bar even higher. Is that what I'm hearing?
That's what I am hearing, yes. I'm hearing that we are going together as a region.
Commissioner Fisher?
Oh, I just have a few quick questions. I think they're quick. I'm curious if we know a percentage of what the community spread is in Clackamas County.
So Dr. President gave us those numbers last week. Last week, it was around 40% of our cases.
And that hasn't changed?
I would have to check with her again. That was late last week, so it probably hasn't. I would have to see what it did over the weekend. I don't have that though, I'm sorry.
That's okay. Then my next question is, I know we have a joint agreement with Washington County for a isolation facility through a hotel. And I'm just curious, first of all, I want to know how that's going, a little bit more information. And then is that part of the turnkey project?
So yes, we are working on the IGA right now. We made a couple changes to it, so Washington County is taking a look at it again. And when you mean it part of the turnkey, that was part of phase 1.
Okay, a turnkey it's a statewide effort with AOC regarding motels, hotels, and I just wasn't sure if this was part of that. But if you don't know that term, then it's not. It's totally fine. I was
Yeah.
just curious.
Okay.
And then my last question, following up on what Paul was saying, is I've been really concerned about our long-term care facilities and what our role can be. And Gary, maybe we could ask Brenda or someone to suggest some advocacy points that are constructive for us to make with the state. I know that we're all involved with AOC. This is an issue that's statewide. I was very concerned after what happened in Foster Creek. I didn't want it to repeat here. We've seen a very increase in deaths based on that facility. I'm not sure how to be an effective voice, but I know that we're responsible for the public health response. The state is responsible for licensing and regulating. And there are definitely best practices that must be put in place and they need to follow. And we need probably somebody really looking at those facilities to making sure that they are following best practices. It's really, really scary. It's just going to be devastating. So I'm not sure, Gary, I'm asking for your help on what we can do as a commission on this, but it's a serious issue.
Talk with Nancy offline and we can engage. Yes.
And then my very last question, Nancy, I want to make sure I'm directing people correctly. I was talking to the mayor of Gladstone, who is letting me know that they are having such trouble filling food requests, even within Gladstone, and they're concerned because they're now needing to go outside of Gladstone and the need is overwhelming. So is my suggestion that she get that suggestion to our emergency operations the right avenue?
Yes. So please have her email eocoperations@clackamas.us
Okay,
with that request. And that is, they will be able to help her.
great. Thank you. I just want to make sure I got it down. I appreciate it.
No problem.
Ken and then Martha.
Nancy, were you reading the stats at the beginning of your report straight from the situation status report that you sent us?
Yes.
Okay, that means I have that information, so
Yeah.
I'll take it from there. Thank you. Do we have any kind of a response from our request to be decoupled from the other two counties?
So we did receive a letter back. I don't know if Chair Bernard or Mr. Schmidt wants to talk about that. We did receive a letter back.
Yes, we did, from the governor, actually the next day, which I forwarded to all of you commissioners. And it acknowledged your request and really just reaffirmed the governor's decision to couple the three counties together.
So in other words, a polite way of saying no.
Correct, yes.
That's what I read. I wanted to be sure I understood it correctly. And that's unfortunately for Mr. Savas and I, that's information we're going to have to share with people who are not going to be happy, needless to say. Thank you.
Martha.
So Nancy, does this mean fundamentally we're no longer considered regional with the Tillamook, Clatsop,
That's,
and Columbia County?
Right.
that's
Not for,
hospital.
yeah, that is the health region, the hospital region, healthcare region. So no, the governor has done the tri-county at this time.
Okay, so they're still, but those other three counties are still going to be dependent on our hospital systems. So I guess I'm just trying to figure out that first they said we were part of one whole area. Now they specifically targeted our three counties. So what is it?
Well, today it's the three counties.
So we're no longer really grouped with the other three counties. Okay.
We're still a health region, but we're not.
A health region.
Yeah, but not when it comes into moving into phase 2, we're not.
Okay. I just think that seems to be inconsistent to me, but that's all right. Okay, thank you.
So
And I did
ahead.
want to make one more comment. Sorry, Jim. In terms of the long-term care facilities, I think the real issue is not just people are getting infected inside the facilities, but then don't you have to contact trace with all the folks that are working there as well? So that's how it's getting spread out throughout the
That is correct. Yeah, that is the point. We do have staff that are infected as well. And then we have to do the contact tracing on that. And then,
Okay.
Which also becomes very intense.
Okay, thank you.
So my suggestion on this issue is when we get close to the 21 days, we take a look at where we're at. And if we're all green, we again request that we be separated from Multnomah County, and hope the response is positive. That's all we can do. All right, so next, Gary.
Any more questions for Nancy? Thank you, Nancy. If you'd hang out though, just for the next item at least. Next, Commissioner Savas is asked to discuss the governor's response letter.
Yes. So Jim, I just heard what you said. And I think that's not a bad idea. However, I think doing something now and getting more clarity, I appreciate what Nancy said. But there's two things that I would say just kind of shocked me a little bit, is that if we're going to wait to where all our indicators are all green, no county has been held to that as a reason not to go from phase 1 to phase 2. Marion County didn't have all greens when they went into phase 2 on Friday. And that goes for a lot of the other counties. So if that's a new bar, that they're all green before we go, I'm concerned. And especially not necessarily that we can't get there. I'm concerned that if another county that we're now tethered to cannot get there. What I suggest is that we send a letter, frankly, to get clarification on those very things. I don't want to be, I'm not here to be confrontational, but I think this is such a big deal, and that we have to have the clarity of what the new rules are. We have changed the rules. We have moved the goalpost. Frankly, it seems as though we moved the goalpost into a county we have no control over. So how do we affect positive change in those other counties if they're not doing well? And the same goes for if we're not doing well, how do they impact us? We asked in our letter, we asked for more communication to the public, that PSAs, public service announcements. We didn't get a response back on that. There were a number of things that we suggested and asked for in the letter, but had no direct response to, whether it be yay or nay. Positive steps that would help alleviate the spread of this disease. So our letter wasn't on one issue, it was on a few. So I would like, I'm going to make the motion that we put a draft a letter to send to the governor asking for clarity on the issues that we asked for.
So, may I respond to one of the things you said? So nowhere has she said that we all have to be agreeing. I use that as an example. The bar has been risen in that she's saying now that all three of us have to go together, but I have not read anywhere that we all have to be green in order to do that. So I just want to make that clarification. I think the bar has been risen just because we're a tri-county now. Thank you.
So is there a second to Paul's motion? Seeing none, we'll move on.
Okay, Chair, just want to say one thing. I'm just going to give you all fair notice. I'm inclined to draft a letter, and if I need to send it on my own, I'll send it on my own.
That's generally not policy, but you have the right to send the letter if you like. Sonia.
Sorry about that. I lowered my hand and didn't press my mute button. You'd think we'd have this down by now. So I don't know if other folks want to know. I love your feedback. But my real concern last week was the projected 1,000 cases a day if we didn't do anything different. And which is, I think, the rationale as to why she put us all together. My big concern is I do not want us to go backwards. I do not want us to be like Union County, have an intense spike and have to go back to phase 1 once we get to phase 2. Would there be is anybody else interested in understanding what that forecasting was based on? And if there's not an understanding, I'm not going to ask for the information because I don't want to give more work to Dr. President or to Nancy, but if other people are interested, I'm just curious about feedback about that.
I thought Union County went from phase 1 to stay home, stay healthy.
No,
Is
they
that
went from
true?
phase 2 to phase 1.
Oh, okay.
I just don't want us to go backwards. That's why I'm thinking that this, and when Dr. President said that her recommendation is that we all move together, I would kind of like to know what the scientific rationale is for that perspective. Because we do not want it to be on us, push to move forward. We rally people around that issue, and then the governor ends up agreeing, then we end up having to go backwards. Because I can tell you, for businesses, that's going to be worse than a slower, steadier opening. It's going to hurt our economy worse.
Well, I think the rationale that the governor used on the phone call is that we're very much tied to one another. Our folks work in, 60 to 70% of us work in Washington County, Multnomah County. Then we're very tied. The first case was a person who worked in Clackamas County, lived in Washington County. And I know Paul argued that Marion County is the same. And that's probably true, but that's not something she was considering. At some point, as a tri-county chair, we did talk about moving together, and we all agreed to that. And then obviously, Multnomah County wasn't going our direction, so we reached out on our own. And I think that's where we're going to end up in 21 days if we're doing great and they're not. But that's something we'll have to consider here in the near future. And I agree. The reason this is done is because this model showed 1,000 people infected a day, which would overrun our hospitals. So Ken.
Yeah, thank you. I don't entirely disagree with Commissioner Savas in terms of the information he would like to get more definitive answers on. I think, however, the timing of a letter is more important. I agree with you that when we hit that 21 days, if we're still 4 out of 6 green, that's the time to make the request for decoupling and include in that some more definitive answers to the questions that were in our original letter. In the meantime, it might even be possible for our EOC director to, behind the scenes, ask those very questions and see if she can get us some more definitive answers to those things. But I think if we follow up too quickly, we end up just kind of creating a scenario where we told you no before, we're going to tell you no again, kind of a situation. And so I think timing is important. So I'm willing to wait until that 21 days to see where we stand. And hopefully we are in a good enough green position to give weight to our request. And I'll leave it at that. Thank you.
Paul.
I'll just be really brief. My point is that I am very concerned about waiting with all this uncertainty without those questions answered. What does that do for the businesses who, by the way, are employers, who, by the way, have employees who are our constituents? This is not just about the businesses. This is about people going back to work, and some of them aren't doing so well. So, I mean, this is huge, and we have to balance. I understand we need to balance all of this, but not having those questions answered and not having the clarity, frankly, I don't think that's acceptable. And again, I'm not trying to be confrontational. I think we need to have the answers. And if the letter touched on all those things, I'd be in a complete agreement. Let's wait and ask for the decoupling later on. But there's two pieces of this. Maybe it's two. I'm not saying it's we need to ask for the decoupling right away. What I'm saying is we need to have clarity on what the new rules are so we know exactly what we're all striving for.
Paul, there was a motion made, no second, so
Okay.
I guess for now, send your letter if you like. All
Okay,
right.
I will.
Okay. So anybody else? Move on to the next issue then.
Well, just to make sure other folks don't want more understanding about the science behind the 1,000 people other than what Jim said, because Dr. President could probably explain it. I just wondered if anybody wants more information. And if everybody says no, then I'm okay with not having that.
That was on the premise that if we did nothing, it would go to 1,000, and the governor did do something, and she issued the order that everyone would wear a mask indoors. So preventative steps were taken. The only thing that didn't make any sense was if that was the case, putting Multnomah County in the phase one, I'm still scratching my head on that one because they've had over 140 something cases since last Thursday.
Yeah. So, hey, Gary, I'll leave it up to you. Do you think we need more information? I just don't want to give people more work. Does that sound like a good plan?
Yes.
So I did have my hand up, and this is one statement I'm going to make, is that we are combined with the other two counties, but we are not getting the same level of financial support. And that is wrong. I'm sorry.
Yep.
If we're going to be considered a tri-county region, and of course the state is saying it's because, but they have flexibility because we don't meet the threshold of a number of people. I just think that's really putting us in a bind. So we are being held to a higher bar without the same level of resources that the other two counties have access to. So let's hope they get their act together. That's about the only thing I have to say, because we are getting our act together, it seems to me, and we're doing it in a leaner fashion. So I don't really understand why the requirement isn't followed with the dollars to do the job.
All I
Thank
can
you,
tell
Martha.
all I can tell you is I said it 3 times, and 3 times she said no. I mean, what else can we do?
I have my own thoughts as to why this is happening, but I'll leave it to that. But
Just, hey, Jim, one other thing we could do, which I've been doing, is when people are concerned and they're talking to us, like different elected officials from county, I say, communicate with the governor about the resources, because we would love to have a direct allocation so we can support our businesses better.
All right, let's move on to the next issue.
Okay, we're moving away from COVID. Thank you, Nancy, very much. Next is, and Brenda, if you could bring in our sheriff's team. I see Under Sheriff Brandenburg is here and Nancy Artman. I'm not sure who else. This is an intergovernmental agreement for transit police services. Commissioners, you asked that this topic be pulled from your consent agenda last week for more information. It is about an intergovernmental agreement between TriMet, the City of Portland, and the Clackamas County Sheriff's Office for transit police services. This is an opportunity for you to ask any questions you have. I'm sorry, Sheriff Roberts is here. Thank you, Sheriff. Any questions you have before it goes back on your consent agenda, which currently it is back on your consent agenda for this Thursday. So hopefully you can get your questions answered today, or what other information you may need. TriMet also sent a letter, which I forwarded to all of you commissioners, with some further background on this IGA as well. So with that, if Sheriff, you're willing to maybe do a quick intro for this, and then our commissioners can ask any questions. Thank you.
Sure, and I think most importantly, just want to make sure we're here to answer questions. So just currently, to give you an idea, TriMet funds 5 deputies and 1 sergeant, and it definitely makes a huge impact on our ability to combat issues that happen on the bus lines, on the rail, etc., and has made a huge difference. The calls actually that we've had over 1,000 calls for service in 2019, and that's actually May through June, I guess. May 2019 to June of 20 of this year. So, so it is actually busy. Our goal is making sure a while back we made some changes so that they are remaining for the most part in Clackamas County, keeping our community safe. So I think with that, I'd just open it up for any questions, and we see it as a benefit. They are making some changes. As you know, Portland Police Bureau is not wanting to be the lead, pretty much stepping completely away from it, is my understanding. Sheriff Reese with Multnomah County is stepping in and taking up that role as kind of the lead agency, trying to make it more of a consortium of the partners that help keep the light rail system and bus systems safe. So they are moving forward with more discussions that's why it was just temporary to extend the time till December, because Multnomah County is working some of those issues out. So,
Right.
any questions?
Paul's up first.
Yeah, so thank you, Sheriff. So at 1,000 calls approximately per year, that's roughly about 3 calls per day. And that's Clackamas County, right? Only, that's not like Lake Oswego, well, not like Milwaukee, for example, or any other city that has a transit, whether it's a bus going through their town. Those aren't included in that number?
These aren't people.
Yeah, these are strictly our deputies and our people that are handling those calls that I had mentioned.
So I just have a concern that if, as I understand it, the city of Portland and the city of Milwaukee both decided to defund, they voted to defund and not participate in this, in law enforcement on transit, whether it's the bus lines or whether it's the light rail lines. And I know that's alarming actually to people I talked to at TriMet. They're concerned about that. Now, I know there was some confusion between the fare inspectors and law enforcement. They're 2 different things doing 2 different functions. So we're not talking fare inspectors, we're talking law enforcement. And, you know, it was just very concerning, as I mentioned before, that this Jeremy Christian guy, he's the guy who stabbed and killed 2 people, or stabbed 3 people, killed 2 of them on the light rail line in Portland, defending 2 people of color, 2 girls, people of color. So there's obviously dangerous situations. There's definitely a need for law enforcement, and knowing that the lion's share of transit operations in this region are in Portland, I'm struck with how much more work or danger we're putting our citizens in Clackamas County that are boarding and going into Portland. That puts a lot of people at risk, and maybe even your deputies at risk. You know, I've talked to some of your staff over the years who have served on the green line and now the orange line, and indicated that you guys are busy, you guys are doing good work, and the work out there is needed. Certainly, in this heightened situation about, you know, racism or profiling, we're all sensitive to that, and I want to believe, and it's a policy we're going to be working on in more detail to make sure we're not doing any profiling. There's not any racist type of motivations by any law enforcement. I'm not suggesting that, but we need to make sure that that's clear. So I'm just talking about people that are actually putting the public at risk. And that's not, first and foremost, I know a responsibility of all of ours, especially law enforcement. So I just want to get greater understanding of what you think we're at risk of, and if it's really safe actually to continue transit operations, frankly, period, in this region until there's adequate law enforcement.
Yeah, I mean, I think that, yeah, let me give you an analogy, is when the green line opened up, we anticipated a significant increase in crime at the town center, and we really tried to plan for it. We did not have the staff that was appropriate. I can tell you that crime at the town center closest to the green line increased by 400% crime. So it has taken us a long time to bring those numbers down. And so the connection between what was happening there and the use of the light rail system was a platform that was being used. There's actually been some documentaries done, national documentaries on the light rail system here in Portland. And we have come a long ways. I think that regardless if we will be forced to respond to 911 calls if it's connected. So, and not having the money to do so would even be more of an impact on the sheriff's office. So my belief is we're absolutely doing the best job we can with the resource provided. I know you've got a document from Marla, a blog, the executive director, and there's been a lot of changes, which we think were positive changes for TriMet, and even looking at other ones to make sure that there is not, racial profiling. I also want to reiterate, too, we enter into STOP data, which is a statewide data system to make sure that our numbers are proportionate to the population we serve, and it is just what I would hope to see. So Anyway, I hope I answered your question, Paul.
Well, just this one, if you could, is that going to put if Portland and Milwaukee both pull back, is that going to put our public and officers at risk, more risk than they are today?
Well, I think that anytime you have a reduction in law enforcement services, that yes, things can increase, because oftentimes just our presence alone can be a deterrent to crime. So while Portland has pulled out, which is disappointing, that Sheriff Reese is looking at how they can step things up as kind of this region area, and the TriMet is willing to fund that. So our focus has been maintaining it on Clackamas County. And right now, I feel like those 6 positions do help keep our community safe. And I'm not going to comment on other portions of the system, but I can tell you in Clackamas County, I feel like our end of the line and our activity is we're doing well.
All right, Sonia.
Thanks. Thank you, Sheriff, for being here. I mean, I got a whole bunch of questions that should probably go pretty quickly. So I'll just go ahead and start. I want to make sure I understood. You said that the contract will be extended until December.
Yes.
Okay, I just want to make sure I heard that right. And then I'm curious, out of those 1,000 calls, what kind of calls are they? Do you have any breakdown or explanation?
We do. We can
Yeah,
send it
and my
over.
under sheriff, Angie, sheriff-elect, has some of the data in front, and I'm going to have her talk about some of that.
Morning, commissioners.
Morning, Angie.
Morning, County Administrator Schmidt. So we do have breakdowns of calls for service. I don't have a deep breakdown, but I have self-initiated activities and dispatched activities for the TriMet folks, and also other law enforcement, of calls taken on the transit system. Let's see here. So about, getting to the right stuff here. Breakdown at transit calls. So our calls dispatched are about 1,040. Self-initiated was 554. This also may also include other law enforcement jurisdictions responding to the light rail and bus service lines. This is not just light rail, so that's an important factor. It's all of TriMet systems throughout the county. For example, when our folks came into the county about a year ago, exclusively into Clackamas County, our folks even went out to the Estacada line, TriMet lines, and people are like, whoa, you guys actually service out here. Yes, we do, because now our folks are concentrating just on Clackamas County, safety and security of the TriMet lines, wherever they go in the county. So let me.
Angie, what does self-initiated mean?
So that is
self-initiated call.
Yeah, that's a good question. So that is a call for service that the officers will on view or not be dispatched. So it's self-initiated activity, which is a good thing because that means that we're being proactive, we're being present. Like the sheriff said, just our mere presence over in our TriMet areas is a deterrent to crime. Also provides comfort and security for those who are accessing the TriMet services throughout the county. Let's see here. So I have some of these breakdowns. We have welfare checks. We have some traffic stops. We have community contacts. We have premise checks. We have suspicious folks that may have been called in by other people. We have mere conversations with folks, and then we have details, which is the largest chunk. And I think part of the details are, when TriMet runs some of their missions, or they call us to be in an area when they're doing functions that TriMet would like police to be in the area for.
Okay, so just so I understand, self-initiated, those are calls from within the police itself for calls regarding the transit system. So about half of them are internal.
So it's me. So if I'm working TriMet and I decide that I would like to stop a car, that is a self-initiated activity. That's not a call for service. So if someone calls 911 or the non-emergency line and says, I would like to talk to, have a police officer respond to this bus stop or on the light rail, that's the difference between self-initiated versus a call for service. Does that make sense?
A little bit. I'm just trying to get a sense. I'm trying to put all the pieces together. Okay, I'm going to go a little faster.
Okay.
I have some assumptions, and because I'm getting bits and pieces of information from lots of different sources, and I don't know if it's true or not. So my understanding from one source is that there was a bill that was introduced that did not pass, which said that transit police would not do fare inspections, but they were doing fare inspections previously. That's my understanding, that the district attorneys are not prosecuting those because of racial disparities, that 4 times as many African Americans were found in violation from the transit police. This is region-wide, not Clackamas County. And so any fare violation that the transit police or anybody else comes up to goes through an administrative law process through TriMet that's not part of our normal criminal justice process. Is that true?
So we're not doing fare checks. That is something that we don't do. And I think Executive Director Marla Blagg's letter and information that she sent to you all talked about the fare inspections. That is not the primary function of police on the TriMet lines. The primary function is safety and security, and that is even mere presence. We don't check fares. It's actually not even a crime, according to the executive director, that it's a violation. And they have fare inspectors who do that work. But our police officers are not stopping people checking tickets to see if people have paid.
Can I add to that? The only time they would ever ask for, do you have a fare, is to calm things down.
Yeah.
Sir, should you be on this bus? Do you have a fare? Other than that, they don't write tickets or citations or ever ask, only in a situation like that to calm things down.
So Angie, do we have, where Portland has done a study on how the transit police interaction has resulted in racial disparities, do we have those numbers for Clackamas County? Like who's been arrested, what types of calls are initiated, anything on a racial breakdown?
We could get those because we do enter all of our data into what's called stop data that's required to the Department of Justice every year. And so we're one of the tier 1 organizations. And so we would have that and we can get that.
That would be great. I would love to see that.
Yeah.
And so also numbers throughout Clackamas County as far as probation violations and also arrests and convictions as well, if that's not too hard to pull. Overall, countywide. I have 2 more questions, and I'm trying to go fast, but you guys, I tried to get this studied, and I couldn't get these answered for clarity. So there is this IGA, and it's structured in a way where the different jurisdictions become a part of it. So Paul kind of alluded to this, but with Milwaukee pulling out, how does that affect the structure of the IGA?
Their guys were down.
So I believe their folks were 2 people. That's what they have had committed to, I believe. I can't really speak for them. So I don't know how that's going to really affect us with our team here in Clackamas County.
Okay, I'm just curious, those resources from TriMet then get redistributed to Clackamas County for us to provide more transit police, or have those details yet to be worked out?
I think that's fairly new for us. So we haven't talked with TriMet about that at all. Really, and for us, we really want to concentrate on Clackamas County and Clackamas County residents writing those systems. So that's where we would like these resources to stay. And I mean, it could be possible that they would want us to provide more resources for us to provide more officers. We just don't know.
Okay, and then my last question, Sheriff Roberts talked about some forms of community input or outreach. I'm not sure what has happened in the past or what's planned for the future as far as engaging community, because obviously this has become an issue to evaluate.
The TriMet lines and TriMet.
Yeah, just transit police service and what's being done there.
Okay, did you want to talk?
Yeah, I think that most importantly is that to make sure that, first of all, that we're collecting all the data that can kind of make sure that guide and direct us of how we're doing the very best job we can. I think that's first and foremost. And they have, as I said, TriMet, I think, has done a good job at making some changes. The other thing that I think is why I think it's important for us to be in here, and I want to talk about some things that are real important to me, and that is as you all know, they closed the Hooper Center, and oftentimes we get calls of people that are under the influence, perhaps being obnoxious, bothering other customers of the light rail system, and sometimes so intoxicated. We do not take intoxicated people to our jail just to detox them. We would take them to the Hooper Center. And that is, once again, why I was so disappointed. Within a few days' notice, I find out that they're closing the Hooper Center. So having that happen, and then also, as you know, I'm fighting hard to keep our BHU, our behavioral health unit, intact, and that that is planned to change dramatically. So, which I'm adamantly opposed to. I believe that that service also helps us deal with that population that oftentimes struggle with mental illness or addiction issues. So. So I think that these social service parts of that we have worked so hard to partner with are being taken away from us and create more challenges for us. So I think if you pull the police out of this mix completely, I think you will see that digress as being a safe system to ride. And a lot of people really depend on using light rail. We want to make sure that we keep it as safe as possible and make sure we're also paying attention to the data of the people that we're contacting. And our belief has always been is we want to plug them into services. And as Jim and many others know, jail is not the right place for a lot of this population. So what we really need is making sure we're directing them into services and not getting into, as you heard Angie say, we're not citing people for a violation. So it's really to keep that system safe.
So that's really helpful. I've been asking for more input about when you talk about the behavioral health support is changing, and I've asked Gary, and I'm hoping the board can be briefed on that issue because I think it's really, really important that we are up to date on that. But I'm still curious about the community engagement process, and I'm asking this question because we did contract with the Coalition of Communities of Color that's going to look countywide and assess these issues, and there just might be an opportunity. I don't know about the time frame. I don't know what's happening in the next 6 months, but you had mentioned that this contract is till December to do for some reason, and I'm not sure where our opportunities are to engage.
Yeah, I think the contract was extended just to work out the whole changes that are going on between moving it away from Portland and to Multnomah County, and to really kind of have some more time to kind of look at, okay, what are the things that we as a county want to see versus just kind of adopting the way it was from Multnomah County's structure, or Portland structure, I mean.
Oh, that's a really good clarification. Is there a community engagement process as part of that?
Yeah, I'm not aware of. I know a lot of the law enforcement in the region has participated in some discussion. There's been a reach out to a number of different individuals. I would say no big groups, but I think really one of the challenges, Ben, which is facing all of us, is COVID. And just really trying to get the people around the table has been, I think, a little more challenging. But I think it's a great opportunity over the next several months to really look at the contract and what are the things that we would like to see changed in it, and most importantly too, I think in the contract, what I also want to see is I would like to personally see data from TriMet as a part of the contract of focusing on the issues to make sure we are doing all the things the best we can.
All right, thank you. That was very helpful, by the way.
Yeah.
Paul?
Yeah, thank you. I did want to just say that not only have I talked to officers who have worked and sheriff deputies who have worked on the transit lines and their experiences, but also the drivers of the buses, and some of which I know. And it is something that is always worrisome to them. I don't think there's ever a time and point where some of them told me that they feel 100% safe all the time unless their unit's empty, right? But there again, they're just one stop away from a rider boarding and being back at risk. So it's important, I think, that we provide the service. But I just want to clarify for the public is that the monies that pay for this come from TriMet, and TriMet wants to have the security there. They know that. That's what they communicated to me as of yesterday, even knowing that we're going to talk about this today. And so what law enforcement agency fills that gap remains to be seen. If there is an ask for an expansion of those services to keep the line safe. But the other issue that's been expressed, I don't know how that activity is going, but I know that there's been gang activity historically, right? And I don't know if that's been on the upswing or the downswing. But Sheriff, do you have any numbers on that or any idea if gang, because it's something that has been, they use transit to move around. And so I just didn't know what that status was on gang activity.
Yeah, I don't have that data in front of me. I could we'll look into getting you some information. I think once again, I think that we've obviously seen in Portland. I feel sometimes there's a shooting every other night at least, and I can tell you that again, we have kind of made this commitment that our top priority is to the citizens of Clackamas County and making sure that we're providing that service, helping, make sure the bus drivers feel safe, having conversations, and if there is a call that comes in, to make sure that our response is appropriate and timely, and most importantly, that everybody's treated respectfully. And so, again, I think it comes back to really kind of focusing on our data in our county, and I would say that it is what I would consider pretty safe to ride any of the TriMet systems in our county.
Well, thank you, Sheriff. Doug did call me this morning. The chair of Multnomah County had not really had a conversation with him, so we are meeting with him. So the goal here is to just put this on the consent agenda for this Friday.
Okay.
Okay. All right. Let's move that forward. Thank you, Sheriff.
Yep,
very informative. Thank you. All right. Let's move on. Thank you.
This is already on your consent agenda, commissioners, for this Thursday, so it will remain there for that. Thank you, Sheriff Roberts under Sheriff Brandenburg. Nancy, thank you for being here too. All right, we'll move on. But first, commissioners, I want to do a time check. We have some still important topics for you. It's 11:20. Are you able to go until noon today, or would you like to meet this afternoon?
Well, I'm registered for an Oregon City Business Alliance thing. Let's see what we can get in the next 10 minutes.
Okay. All right. So, Drenna, can you please bring in Laura and Scott? Next is North Clackamas Parks and Recreation District Advisory Board appointments. Commissioners, I'm seeking your guidance on how to move forward on the District Advisory Board. There are 9 seats on the District Advisory Board. The board has not been meeting at the request of the Board of Commissioners that you wanted to meet as the NCPRD Board of Directors first before the DAB meets again. You were going to meet as the district board in March, but then COVID hit. So that meeting has been postponed now until early August, but is scheduled for early August, the district board meeting. So therefore, the DAB will not meet at least until mid-August at the soonest. So all of the 9 seats on the DAB, 1, 2, 3, 4, 5, have expired or are about to expire next week. So your choices are, you can temporarily extend the terms of all those seats that are expiring, or you can do what the bylaws state is you do a recruitment when there's a vacancy on the district advisory board. So I'm seeking your guidance of what you'd like to do next, or we can hold until the district board meets at the middle of August, early August. I'm just seeking your direction of how you'd like to move forward, or to just to postpone it entirely and wait until after the board of directors meets.
So Paul, and then myself, and then Ken.
So, yeah, we have extended these already once before. I don't have a problem with going through the process and putting strong consideration on renewing those folks. But because there is vacancies that are going to be created by the withdrawal of Happy Valley, and because some of our members of the DAB and the public have been very, I would say, somewhat distraught that we haven't followed our own rules and the bylaws, that it would be, I think, problematic not to at least abide what the bylaws say and put out the notification advertisement for the openings. And I'm perfectly fine with putting strong consideration on renewing those folks, but we just got to go through the process. But there's still vacancies anyhow, so we got to fill that. And we got to be able to complete the work on the bylaws, but we need to meet as a board of directors. We promised that. We promised everyone that we would meet at the board of directors before we did anything. But I think that it's awfully safe to simply advertise at this point, encourage all of our DAB members to apply, and I think that's the fairest thing for everyone, and we abide by the rules. Thank you.
So Ken?
Well, that's essentially what I was going to say. Let's extend the terms until such time as we have our meeting as the NCBRD Board of Directors and do a recruitment in the meantime, but essentially follow the rules. So I'm good to do that.
Martha?
So my question is someone from Happy Valley still on the board? Should we, I mean.
No, they're off.
Are you sure?
If I can answer that, there is a seat of a Happy Valley City Councilor appointed by the City Council. Because Happy Valley is no longer in the district, we could argue that seat is now not a seat anymore. Yet there's a second seat for a representative of a city east of I-205. Well, there's only one city east of 205, and that's Happy Valley. But that is a community member, and that seat is vacant, which I don't know, commissioners. See, the bylaws have not been updated to address the withdrawal of Happy Valley. So that is part of the ongoing issue that you have as well.
The problem is if we bring all these people in, we got to start all over. But also the seat that Paul is in right now was a temporary seat. Would we extend that, or would we reappoint that? I want to get this done before I leave, and bylaws tend to last years figuring this out. So let's get the damn thing done and either extend the terms or or make the bylaws ourselves. And a commissioner is not supposed, we've already had this discussion, 10 times. The position of a commissioner on the board is not one of those bylaws. So what do you want to do? Make your decision. Let's get it done.
Follow the bylaws and advertise and expect to renew those positions. And that is as simple as that. All we need to do is just tell staff to go advertise and follow the bylaws.
And actually, I think that's what we should do, because there were people who were pretty upset because we weren't following the rules. So let's advertise. But the current bylaws do not allow a commissioner on there, so that position you will not be on there, Paul. Correct?
Well, we will talk about that at the board of directors meeting.
All right, so let's go ahead and advertise for.
Advertise and do it. Let's
So
do
I
it.
need to, respectfully, I need to clarify. So Paul is, Commissioner Savas is in what was the unincorporated east of I-205. So are we not advertising for that position then?
Gary, my advice is just advertise, just do what the bylaws say. It doesn't, when the bylaws say advertise for the open positions, you don't have to worry about that right now, the way I read it, unless you're reading something different. The one seat held by Suzanne Estelle, okay, is a vacant seat, for example.
Okay.
That's clearly a vacant seat.
All right. We will follow the bylaws. We'll do recruitments and notify those who are who have these seats. They're welcome to reapply if they choose.
Okay,
We'll
great.
do that.
Let's do it.
Okay, very good. Moving on. All right, so commissioners, all of you at one point have attended meetings that have occurred the last 2 weeks for electeds and Black community members protest response meeting. This is a meeting that has been sponsored by JOIN, J-O-I-N. It's a nonprofit based in the Portland area that provides homeless services. And this meeting has had many of our Black, African American, and people of color community members, and also representatives of Clackamas, Washington, Multnomah County leadership, elected leadership, City of Portland, and Metro Regional Government elected leadership. At this last meeting last week, Commissioners Fisher and Savas attended. I guess I'd like to ask if either Commissioner, any of you would like to give an update on what you heard. There are discussions about what commitments Clackamas County will make going forward. No decisions have been made. I'm just opening this to have a public discussion of what you'd like to share about the meeting or any guidance moving forward on these meetings. There is another meeting this Friday as well.
So Paul has his hand up.
Yeah, so
And hit your raise
on
hand.
Friday, I remained silent and announced that I remained silent because we didn't know exactly, we weren't organized and we weren't ready for what they were about to roll out because we hadn't met as a board to do that. And we still haven't met as a board, even for preparation for what is going to be discussed on Friday. I would say that what is being discussed overall seems to be more legislative in nature, and or it is also more Portland based than it is to the counties. There is some small things that they're asking counties to do. But I think that the only way we can, whether it's myself or whether it's Martha or whether it's Sonia, whoever represents the county, that we need board direction and a work session on that, or we're just going to have to just sit by and just listen in. And I assume from the very beginning, our role would be listening and learning. But we haven't had that opportunity really.
So
Ken.
Can we continue this discussion this afternoon? This is probably going to require a lot more conversation than the next 3 or 4 minutes are going to allow.
Sure,
Quite
let's
frankly.
do this for this afternoon.
All right, so we have not noticed issues for this afternoon. So Stephen, can the board still meet this afternoon?
Yes, just announce that you are continuing the issues discussion this afternoon, same link. And commencing at what time, Gary?
I'm going to propose 1:30 because we have enough to still talk about that will take at least an hour. So
Okay.
1:30 p.m. today.
All right, so we will adjourn until 1:30 to this continue this issues discussion. With that, see you at 1:30.
Okay.